Advisory Group, Dr. Hoa Nguyen. Doc, is that you with your Facebook up, or because we're getting a little feedback?
No. It's me. Hold
Okay,
on 1 second. Let me close the door because uh, I'm still at home.
right on.
Okay. I
Wow,
was gonna say it
nice.
looks different.
Yeah. Doc, so we had the meeting last night, the PAG meeting, and we kind of went over, some specifics with Dr. Cabrera, but I know you had said it was a productive meeting and the governor was in attendance. So I guess what can you tell us about what happened in that meeting last night?
Um, there's it's all about what they're trying to do is for us to move forward and because right now the situation we are in is not good. We really need to have a very clear communication between um, the public health, the physician advisory group, and the business advisory group to kind of make the decision to move forward. Because decision the past week or so, I think sometimes it's not clear to communicate within the three group, and that create a lot of chaos. But I appreciate the governor who was there last night, and I think that we all learned that we need to really talk to each other, so that way decision make in next weeks or months it be better served. So that way, if the public asks the member of the PAC, the physician advisory group, that we can know how um, to kind of answer the guideline, the question on the guideline. So again, I told Patty, I said it's not that video from post is not to mean to harp on anyone. I mean that's the
Right, and just let me jump in,
the
Doc.
way it goes.
For those of you guys just joining us, we had Dr. Nguyen on the show last week, and he had told us again that the Physicians Advisory Group was advising for individual exercise at parks and beaches to be allowed, right? And then it ended up not being allowed. So that was not the recommendation the doctors made. Of course, the doctors want you to be healthy, right? And it helps, Doc. I
Yes.
was doing this like sledgehammer banging on the tire thing yesterday. That was like, I was just seeing COVID 19's face, and I was like, you suck, you stupid. So, yeah, people got to
Yeah.
exercise.
Yeah, it's we talked about that last night because I say when all the people need to exercise, right? So that's something that she will reconsider again, with the condition that people really abide the rule that you go out to the beach and the park to exercise, and not to have picnic and have gathering out there in the beach because exercise is good, and she agree, and she will consider that. But she's gonna need the help of everyone in Guam to abide by the rule that you go out there for fresh air, for exercise, and not to bring your family out there for picnic and things like that. That's not a good thing to do, especially we are in the surge of this virus right now. So, as Dr. Cabrera say, you know, is we are in the surge. Hospital somewhat maxed out capacity. We have 28 people in the hospital, um, and the case is still going up, and we will see that hopefully with the people staying home, and the mobility data show that people are beginning to stay home. So we should see a downward curve of the virus in the next week or 2 weeks or so, because it's lag behind on how much people move. So hopefully we get better and we can get out this peak hole one.
Doc,
So uh, yes.
Friday, it's supposed to end, but it's not going to end, is it? The lockdown, the PCOR 1?
Yeah. She had to make the decision, but right now, if we're going to go with the four guidelines, the two of them, the biggest part is we have met is hospitalization is really is over capacity at this point and to handle the COVID patient, and our numbers still go up every day. So it's hopefully by next week you see a downward curve of the positive case. We all keep our finger crossed. Again, we need the people to abide by that. And Christopher, this is what, as a practice physician, seen every day. And I tell you, it's not different um, um, with any other clinic is that the same story. No, you hear the same story every day. Every patient come in is that I went over to my sister house and went to my cousin house, have dinner, and then a week later I got a phone call that my cousin, my sister is positive. Now the whole family is positive. So that story is repeat daily multiple time. So that's why it's very important for us. We have this is one we have a lot of extended family at this point. But I would ask everybody, extended family, if you don't live in the same house that you are living, try to FaceTime or WhatsApp or something for about a week or two, so we can get over this cycle here. But if we keep hearing that we go to dinner at a relative house, man, we never go get out this hole. So we really need everyone to stay home and stay within your household for the next week or two, and help everybody, the governor, the PAC, and the tax, everybody, so we can go through this. And we are getting tired, really getting tired. And the healthcare system, I tell you, if the infection rate on the healthcare system, on the healthcare worker going up, we are going to be in more trouble than we are at this point. So we need to help each other doing this thing.
Right. Doc, I just wanted to go over this. This is the triggers to make informed decisions to move from PCOR 1 to PCOR 2. And so these are the four that were released way back when. So just to go over
Yeah,
them.
full guideline.
Yeah. So cases, downward trend of confirmed cases and a downward trend of positive tests. We're not going to,
Yeah.
that's a no, right?
We, we're not
No.
going to meet that one.
Yeah.
And the
Hospitalization,
hospitalization, we're going to meet that one.
testing.
Testing, as of last night, since we have actually, we have now a, a consensus within all the lab, GRMC, public health, and diagnostic lab. So we have more ability now. I wish that's done before, and so we can combine the three of them. We can do probably 500-600 tests a day. That's what it should be combined in the past. So I think the testing would be okay. It's just the first two. We are not okay in the first two. The tracing and the contact. PAC feel like we're still behind.
Yeah.
So
Doc, let me
3
just
out
share
of the 4 guideline.
our personal experiences. We had a positive here on our news team, Adriana Cotero. That was on, Bree, what date was that?
That was wow.
The 13th? Yeah, the 13th. So yesterday, was that yesterday or Monday? Monday, we got the call from public health.
Right, because they were waiting for the numbers, and a part of that was me trying to get the entire list of everybody's numbers,
Right.
and giving it to public health. But majority of us had been tested and we had the results, and so I
Right.
just kind of like forwarded everything to them on that Friday. So they
Yeah.
called on Monday. So
Right. Yeah.
But
So-
again, just going back to the triggers, so 3 out of 4 cases, no; hospitalization, no; and contact tracing, we're not meeting them.
Yes.
But testing, you had a meeting last night, and it looks like we're going to be okay because now we have the ability, since we're combining everything, to run at least 600 tests.
1 out of
Yes.
4. That's not good. That's a F, right?
Yeah. I mean, the first two, guys, is easy. If we follow
Stay
the rule
home?
again, that's the whole thing. Yes. And the first two is beatable, but we need everybody. So Chris, you gotta yell out, "Stay home!" Really loud. That's the only thing people want to listen to, and so
We
you
need to
gotta
get all the
let them stay
doctors to
home.
do this and put together a PSA,
Where
just
we just
yelling it
all
out.
yell it out. You know what I mean? It feels good.
Yeah, I
He's
mean,
like,
it's
yeah,
hard
okay.
to if we cannot police everything, and just like Dr. Caprera say, we're going to elicit the mayor council in helping to enforce the monitoring of the people in their village to make sure that they don't get together on a party. We still hear there's barbecue in the backyard with quite a few people all the time. So we need the mayor to help, and I think public health will establish a hotline that people can call in and report certain activity, because we need all eyes on it to make sure that we get through this as soon as possible.
Yeah. So what was the
So
what else was discussed last night during the PAG meeting?
the biggest part is this, the decision will be made by communicate through, again, public health, the physician advisor group and the business group, and so that have to be done to make sure that we make the right decision. So but I said that's the biggest part of the talk last night, and so and how to identify if where the true resource is. The true source, guy, I tell you, is that the passenger come off island, that come back to the island, and we have the home quarantine that we don't have any data to make sure people truly stay home before they're testing out on day number 7, and we have quite a few that positive on testing out day 7, and unfortunately those people walk around our community and spread the virus. That's number one. So the governor closed that loophole by implement the quarantine mandatory for everyone come in. So that loophole is fixed, but we need to come up with a better system to monitor people on home quarantine as we go forward. So that's something that we talked last night, and they have to come up with the new system to track people somehow. And the other one right now is the current situation is the spread within the extended family.
Mm-hmm.
So we're going to ask the mayor council to help on this one in monitoring this and cut down the spread within the extended family. So those are take long discussion on those things, and we will meet with the mayor council sometime this week to make sure that they can ask for their help. I think all the mayor are really willing to help, so it's really helpful to have them on board.
All right. Okay.
Thanks, Doc.
Anything else?
Okay, but
Are you sure there's
Anything
nothing
else?
you want to tell us
Yeah.
that
You look like you really want to say something.
Yeah, just let it out, Doc. Come on, it's cool.
No,
We're here in the link. It's all right.
just really, guys, really stay home. We really need to, I'm telling you, I'm the only thing I can tell you is that you cannot blame anyone for making a decision, especially the governor, if nobody listen and abide by the rule. We all, every one of us on this whole island, are responsible for our action and need to abide by what she asked, so that way we can get out of this thing as soon as possible. So please, try to not go to the extended family gathering, because we have to stop this virus at this point. Give it 2-3 weeks and we can get back on it, and everyone can be safe again. So please stay home, and they don't live in your house, don't go visit them, because you don't know who's that person, where that person been. So just stay home for now. Okay.
Thank you, Doc.
And that's all I want to say. Again, that post video yesterday is not mean to harm on anyone. It's mean to let people know, how the decision is made, and so that way, people don't point at the physician advisory group and say that's your decision. It's not. Let's just make it clear, and it's not hard on public health, not hard on the governor. It's just make it so people understand decision make in step.
Right.
But the final decision is always the governor. And like I say, on this case, guys, on the current data, no one can tell that she's wrong, right? Because you can see the rate go up.
Yeah.
So whatever decision she make, whatever her thought that she have, she's correct at this point. So we just have to go forward, listen to her, and get out this Pico 1. Okay.
Thank
so
you, Doc.
stay home.
Yeah, stay home. Say it mean.
Okay.
Use your military voice. Come on.
Okay. Okay. Stay home. Okay. That's the message. Okay.
All right.
Okay.
That'll do. That'll do.
Bye, guys. Have
Thank
a
you,
good
Doc.
Bye. Take
Okay.
care.
7:31. We take a really quick break, and we'll go to Dr. Manglotnia of Public Health. She's the medical director, and she's next on the link of the Zoom. Maria Pangilinan is also standing by. Hi, Miss Maria. I see you there. Sorry, we're just trying to bang out the doctors. Okay, she's thumbs up. Right on.